Transition means to me just starting a new life from childhood to adulthood.
Now I've turned 21, I feel like, that's my responsibility.
It makes me feel like, definitely like I've grown up and I'm, becoming more independent.
I see that as you get older, it's better for you to talk to the doctor because you know how you really feel.
It takes time to learn the responsibility and everything.
That's probably first and foremost. You have to be responsible for everything for yourself.
I like the fact that it's my responsibility, and I see that as freedom.
It makes it that much more rewarding to know that I did it, and basically it makes me a lot stronger to know that I'm capable of doing these things.
You'll be confident enough to stand on your own 2 feet.
Good health to me means I can live a long and happy life and fulfill all my dreams that I want to fulfill, and maybe a few more.
I'm Susan Redman, Registered Nurse Consultant for the Florida Department of Health Children's Medical Services. One of my responsibilities at CMS is to direct healthcare transition initiatives. Because of medical advances over the last 2 decades, up to 90% of youth with chronic illnesses and disabilities in the United States will reach the age of 20. In Florida, Children's Medical Services has been a leader in assuring that children and youth have access to up-to-date medical care and that medical and related services are family-centered, community-based, coordinated, and culturally competent. Significant progress has been made in many child health services. However, research indicates that many young adults with childhood-onset chronic conditions in Florida, as well as the other states, do not have the knowledge and skills they need to get the healthcare services and supports they need as adults. We know that in order to be successful, healthcare transition must be a long-term planned process that attends to the medical, psychosocial, educational, and vocational needs of youth and young adults as they move through adolescence to adulthood.
Since the day you were born, your family has been there for you, caring for your every need, taking joy in watching you grow, proud of your accomplishments, big and small, sharing life together and loving you with all their heart. The only constant in life is change, and with every new birthday candle you became more of an individual, more capable and more independent. Growing up with a disability or special health care need presents many challenges. Many people, including your family, doctors, care coordinators, and therapists, have helped to take care of you. However, now that you're getting older, you get to be more in charge of your own health care. Some days it may feel like a heavy burden, but accepting the responsibility will give you more opportunities and more freedom to get out and experience all that life has to offer. And so many experiences are still ahead of you. Someday soon you may be able to drive a car. You may be moving to a new school, perhaps even a college in another city. You may be taking a job soon, starting a career. And of course you will continue to develop friendships, maybe even fall in love. This is your ride on the roller coaster of life with all the highs and lows and everything in between. By becoming an expert in your health condition, accepting the responsibilities, and practicing the skills of independence, you will be creating the foundation of health that will support you in achieving your life goals. Doesn't it seem like the older you get, the less you fit in pediatrics? One important change that will happen over the next few years is saying goodbye to your pediatrician and going to see doctors who take care of adults instead. You might wonder why it's necessary to leave pediatric care. After all, your pediatrician may have cared for you since you were born. The main reason why pediatricians and hospitals insist that you move on is because their focus is healthcare for children and they don't have the resources to care for adults. But most importantly, they lack the expertise to fully address the healthcare needs of an adult. You know, there are certain issues you'll want to discuss with your healthcare provider in private, and a pediatrician just won't do. Well, this process of leaving pediatrics for adult-oriented medical providers is called healthcare transition. In practical terms, healthcare transition also means becoming knowledgeable about your health condition, being responsible for carrying out your health tasks, and making good healthcare decisions. These skills of independence do not come automatically. They have to be learned, practiced, and developed over time. When you were a child, your parents were in charge of your healthcare. As you got older, your healthcare providers may have started asking you questions and getting you involved. On your 18th birthday, you will officially be an adult with new legal rights and responsibilities, and you will be calling the shots. But long before that day comes, you can get started by getting more involved in your healthcare, learning everything you can, and working towards healthcare transition. Children's Medical Service is committed to helping you in this process. We have booklets, workbooks, and training materials to help you prepare for a smooth transition to adult healthcare. Take some time to explore these materials and consider the issues as you plan your transition. Keep in mind that getting good medical care is an important part of staying healthy, and good health supports everything else you want to accomplish.